Hello, my name is Steffi and I'm one of the urology nurses. I'm here to go over preoperative instructions for prostate surgery. You should have received this the day you came in to see one of the doctors. It has your name on it, the name of the surgeon, and the day of surgery. Please just be sure that that's correct. What you need to purchase is 2 bottles of mag citrate and 2 fleets enemas. This is over the counter, and please purchase this anytime now before surgery. With the mag citrate, lemon lime is better than cherry. The day before surgery, please make no plans. If you work that day, you cannot work. You need to be on a clear liquid the entire day before surgery. The last page of the sheet tells you what clear liquids is. Clear liquids is black coffee, tea, soda, Gatorade, any kind of clear broth, any kind of jello, any flavor, it doesn't matter. This is not a colonoscopy. Hard candy, ice pops. Again, look at the sheet. It will go over what is clear and what is not clear. Dairy products and juice with pulp are not clear liquids. Keep yourself very well hydrated the day before surgery. If you are diabetic, do not drink all sugar-free. We don't want your blood sugar to be too low. 10 o'clock in the morning, the day before surgery, you need to drink 1 bottle of mag citrate. Do not leave the house. This is going to cause diarrhea. If by 4 o'clock in the afternoon you have not had a bowel movement, drink a 2nd bottle. Most patients only need 1 bottle. 8 o'clock at night, whether or not you had diarrhea, you need to insert a fleets enema. You're familiar with an enema from the prostate biopsy. If clear liquid is passed with no pieces of stool, you do not need a 2nd enema. You can drink 2 bottles of that clear Ensure the evening before surgery and take a shower using a half a bottle of the HipaCleanse soap. Nothing to eat or drink after midnight except sips of water with essential medication, meaning blood pressure medication and thyroid medication. Anything that's essential you could take with a sip of water the morning of surgery. Please call me if you have any questions. If you are a diabetic, you are not to take diabetic medication in the morning. We'd rather your blood sugar be a little on the higher side than the lower side. As far as the evening before, you could discuss that with the doctor if they want you to take the diabetic medication the evening before. In the morning, you'll take a shower with the HipaCleanse soap. You could also drink 1 more bottle of that clear Ensure, right, an hour or so, right before you leave the hospital. You could drink that bottle. The hospital will call you. If your surgery is on a Monday, the hospital will call you Friday to tell you what time to be at the hospital on Monday. If it's any other day during the week, you will get a phone call the evening before. The phone calls come anytime from 4 o'clock on the day before surgery or Friday from Monday. So if at 2 o'clock in the afternoon you don't get a phone call, don't worry, it doesn't come until 4 o'clock. Sometimes patients call being very concerned about that. Remove all jewelry. Jewelry cannot be worn to the hospital. If you've had a ring on that's been on for a long time, you must take that off. As far as blood thinners go, 1 week before, no aspirin products, including a baby aspirin, no Advil, which is Motrin or ibuprofen, no Aleve, no Celebrex, nothing that's going to make you bleed. You can take Tylenol and Tylenol products. If you are on a prescription blood thinner, please discuss that with the cardiologist when they want you to stop taking that. Okay, I think at this point I've covered that sheet. Again, you should all have my phone number if you have any questions concerning this. You also should have this paper, what to expect after surgery. We usually give that to you the day you come in to see the doctor. Please review this a few times. I'm going to go over a few things right now on this sheet, but again, if you read this a few times, your recuperation after surgery will be much better. This is the catheter, the dreaded catheter that everyone is very afraid of. And let me review this to make you understand and more comfortable with this. This is a catheter. It is soft and mushy, okay? Worst part of a catheter is when it goes in. The beauty is you will all be sleeping, so you'll never know it went in. Oh, they will review this with you in the hospital, but I just want to show you a few things so you understand when you wake up and you see this coming out of you, what's going on here. So the tip of this is in your bladder collecting the urine for about the next 8 days. So I want you to look at the tip of this, and there's a balloon that gets inflated. They put saline or some fluid in this balloon after they put the catheter in, and this sits inside your bladder. You don't know it's there, you don't feel it. The sole purpose of this balloon is to prevent this catheter from coming out. All right, even if it looks like it's moving a little bit, it's not going to come out. If you have a dog, do not let the dog jump on top of you. This will stay in. All right, this is an overnight bag. More the patients seem to use this bag. It is big and holds a real lot of urine. They also send you home with a leg bag, and let me show you this real quickly. You take off the one bag, you undo it like this, and if you want to go for a walk in the neighborhood and the weather is nice, for lack of any medical word, you take the end of this, you smush it on here, and then you have this bag. This is called a leg bag. It straps around your thigh. They give you these little stretchy straps. Goes around your thigh. You could take a walk in the neighborhood, or if you want to go out to dinner, if that's going to ever be again, or any place. Many men use this bag. Otherwise, for the most part, the men use the bigger bag. It holds a lot more urine. And you just drag it around like a little dog, or you could stick it in a ShopRite bag or a Gap bag and just bring it if you go someplace. Otherwise, at home, you could just rest it on the floor. Make sure it's always below your bladder. Already, you may have a bladder spasm, or if you're going to have a bowel movement, you may see some urine coming out around the tip of your penis. That is normal and to be expected. Do not be worried. And again, read that paper, what to expect after surgery. Okay, so again, if there's any urine or blood around the tip of your penis, just wipe it away. You may see some light pink urine in the bag. Imagine if you had a gallon jug of water and you put a drop of food coloring in, it would change the whole gallon jug of water. So if there's a little clot or a little bit of blood, this may look pink. It may never look pink. You could see blood in your urine for 4 to 5 weeks after surgery. That is normal to be expected. If it bothers you, empty the bag or drink more fluids and that will clear up. They will review catheter care and how to use this in the hospital, but I just want to show you this. It's very user-friendly. If you need to empty this bag, there is a clamp here. You undo the clamp, empty this into the toilet, make sure you clamp this back, and then you just tuck it in here. For the smaller bag, also very easy. Let me just show you how this works. This is the leg bag. This has a valve on the bottom here that you just turn and it empties into the toilet. All right here. Again, they will review this with you in the hospital. It is very easy to use. 2 days after surgery, tell you to please take a shower. If surgery is Monday, you can take a shower on Wednesday. If surgery is Wednesday, take a shower on Friday. You will feel so much better and the people around you will be very grateful. Drag either one of these bags in the shower with you. They are waterproof. You'll dry them off when you come out. Let the water more beat up against your back. Clean around the tip of your penis with soap and water and pat dry your abdomen. If you are having regular prostate surgery, the robotic surgery, you will have 3 incisions on your right, 2 on your left, and 1 above your belly button, which is where they take out the prostate. If you're having a single port surgery, then you have 1 incision. Either way, the incisions are covered with glue. There is no stitches or staples on the outside. That glue wears away in 4 to 6 weeks. Do not put lotion or any kind of ointment on there, and please do not scrub that glue. Okay, you'll be able to see your incisions and you will see how quickly they heal. All right, on the 3rd page of the what to expect after surgery, we'll go over the pads with you. You need to go to the grocery store or the pharmacy and buy pads designed for men with prostate surgery. Buy any brand there is. Depends makes them, Tena, T-E-N-A makes them. Sometimes even the store that you're going to makes their own brand. Buy the cheapest there is. They're all the same. These fit in tight underwear. So the day you come back, and the catheter will be in for 7 to 8 days most likely. The day you come back to get the catheter out, please bring a pad with you, not a diaper, and please bring tight underwear, meaning boxer briefs. briefs, tighty whities. These do not fit in boxers. Okay, they fit in a pair of tight underwear. They peel, the back of this peels and sticks in your underwear. I will remind you when you call me after surgery is to bring this. When you come home from the hospital, if you have stairs in your home, you can walk stairs. No heavy lifting for 4 weeks after surgery, nothing heavier than a gallon of milk, but you can walk up the stairs. I encourage you to walk 20 minutes of every hour while you are awake, not during the night. You can miss an hour here and there. The point of getting up to walk is you will feel better. It prevents blood clots. It makes everything in your stomach move around. And you know, on a rainy, crummy day, if you're laying around all day, you feel sluggish. Same thing after surgery. So if you get up and walk, you will see how quickly you'll recuperate. As far as dietary restrictions, you can eat whatever you like after surgery, okay? You may not want a steak, broccoli, and a salad, but eat as tolerated, okay? You do not have to be on clear liquids when you get home. Number one phone call after surgery is, Steph, I think I'm constipated. Keep in mind the day before surgery, you're cleaning yourself out with the mag citrate and the enema, and you're on a clear liquid diet. The day of surgery, you're not eating that much. So it may take 3, 4, 5, even 6 days before you have a bowel movement. If you are not vomiting, we are not concerned, and you will most likely feel rumbling in your stomach. The doctors will send you home with a stool softener. It won't make you go, but when you go, it won't be hard. So again, keep that in mind. If you're the person who has a bowel movement every day between 7 and 9 o'clock in the morning, and you don't have a bowel movement for a few days, that is normal and to be expected as long as you're not vomiting. You will go home with a stool softener. They'll give you a prescription for that. It's called Colace. It will not make you have a bowel movement, but when you go, it won't be hard. So that's that. As far as pain medications go, they will send you home with a narcotic, either Vicodin or the generic of Vicodin and Tylenol number 3, or Tylenol number 3. My recommendation is please keep Tylenol in the house. Some men never need the narcotics. Do not take the narcotics around the clock. It is ordered 1 to 2 tablets every 4 to 6 hours as needed, and I cannot stress the as needed. By day 3, no more narcotics. Again, some men never need to take that. Some men find that Tylenol, extra strength Tylenol, is good enough. But just take it as needed. You will call me when you get home from surgery. I like to speak to everyone after surgery to go over any questions you may have. None of you have ever had prostate surgery before, and I want to make arrangements for the catheter to come out. Please leave a message on my voicemail. You should all have my card. If you don't have my card, it will be attached to this video. My phone number will be attached to this video. I like to touch base with everyone, and that's where I like to make the post-operative appointment, which will be about 8 days after surgery, depending on the day of your surgery. The doctors will speak with you before surgery. So if your anxiety level is like that before surgery, I'm not going to tell you what goes on preoperatively, but by the time the doctors get done speaking with you, you will be very calm and relaxed going into surgery. Our surgical scheduler will contact your insurance company. Please don't contact the insurance company. He will contact the insurance company and get everything authorized. Pre-admission testing will also be scheduled by him. You need to go for your clearance, whether it's a medical clearance, a cardiac clearance, pulmonary, whatever the doctor has told you to go for. As long as you make that appointment, and you must make that appointment, we will get everything over there. If you've seen your physician recently, they may not make you come in. They may just want to see your pre-admission testing. As long as you call your doctor, we will get the clearance from them. You are all, again, going to call me when you get home from the hospital to make a post-operative appointment 1 week later. Let me think of what else, if there's anything else I missed. I want you to watch this video a few times to make sure you're familiar with everything, particularly the bowel prep. If you should have any other questions after watching this video, please never hesitate to call me. I am not in on Wednesdays, but I will always call you back. Good luck with your surgery. You will do beautifully. And when I see you a week later, I won't even know you had surgery until you lift up your shirt. You will feel that good. Okay? Again, good luck.